I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. Today on the VEC Vaccine Notes, we're going to be talking about 3 diseases and the vaccines that protect against them: diphtheria, tetanus, and pertussis. They're also known as the strangling angel of children, lockjaw, and the 100-day cough. These diseases used to be so frequent that people had those nicknames for them, and you'll see why each nickname is well-deserved. First, it's important to know that each of these diseases are caused by bacteria, but it's not the bacteria themselves that actually make us sick. It's poisons produced by each bacteria, called toxins, that make us sick. And so what's unique about the vaccines that are used to protect us against diphtheria, tetanus, and pertussis are that we're actually protecting against those toxins as opposed to the vaccines containing a part of each of those bacteria. But more about that later. Let's first talk about each of these diseases. Diphtheria is the least common of the 3 diseases that we are talking about today. Between 1996 and 2018, we've only had 14 cases of diphtheria in the United States and only 1 death. But before vaccinations were available, this was a deadly disease for children. It was called the strangling angel of children because it causes a membrane to form in the back of the throat. And when you look into the throat of the child who is infected, the membrane would actually look like angel's wings. Unfortunately, the adjective strangling needed to be added because that membrane would also make it difficult for the children to breathe, and they could suffocate. The next disease we're going to talk about is tetanus. Now, tetanus is interesting because it's the only vaccine-preventable disease that's not spread from one person to another. So no matter how many people are vaccinated, your personal risk for tetanus remains the same. The tetanus bacteria live in the soil, and so if you get a cut or have a wound, or if you have frostbite or burns, and those bacteria get under your skin, that's when they can start producing the toxin. The toxin leads to muscle spasms, and because often those muscle spasms occur in the jaw and the neck, this disease has the nickname lockjaw. The spasms are very painful and can lead to suffocation, particularly if the spasms occur in the area of the neck where people are using the muscles to breathe. Now, there's another form of tetanus called neonatal tetanus. It's not common at all. It doesn't occur in the United States because in most cases we're living in a clean environment. But in areas of the world where infants are born in unclean conditions, they can get these infections pretty quickly after birth, particularly related to cleansing the area around the umbilical cord. That version of tetanus is known as neonatal tetanus, and it can cause those children to die very quickly after birth. In the United States, tetanus is rare. Between 2013 and 2022, there were about 30 cases throughout the country and about 13 deaths. The third disease that we're going to talk about today is pertussis, and it has a few nicknames. It's more commonly referred to as whooping cough, and sometimes it's referred to as the 100-day cough. As you can imagine, based on those nicknames, the cough is the most significant component of pertussis. People can cough so frequently and so hard that they vomit, they break ribs, they burst blood vessels, including in their eye. They can even develop hernias. People with pertussis can have up to 15 severe coughing spells per day. Now, in young infants whose windpipes are very narrow, the coughing makes breathing difficult. And pertussis also causes a lot of mucus generation. So between the mucus and the coughing in a narrow windpipe of an infant, this is why the disease is so deadly for very young babies. Babies can stop breathing for a time. That's called apnea. They can turn blue between coughing episodes. And when they breathe in really deeply to try to get that air past the mucus and the narrow windpipe, that's when they make that traditional whooping sound that you hear about, and why this disease has that nickname of whooping cough. Pertussis is the most common of the 3 diseases that we're talking about today. In 2024, there were about 35,000 cases in the United States with 10 deaths. and 6 of those 10 deaths were in infants less than 1 year of age because of the breathing difficulties that we talked about. There are 3 other things to know about pertussis before we move on. First, pertussis is unique in that typically older teens and adults give this infection to infants. That's atypical for how we usually get diseases because usually kids bring them home to us. Second, when adults get pertussis, because they often don't go to the doctor and the early signs of pertussis are very cold-like in nature with a little bit of coughing, by the time that somebody does go to the doctor because they've had this prolonged cough, the bacteria are usually gone. And so it's hard to test for that disease and have it come back positive after the time period that's elapsed. So we anticipate that most of the years we actually undercount the number of cases of pertussis that occur in this country. And finally, when you get pertussis, that cough can last up to 3 months. So even after you're feeling better, that cough lingers. And that's why pertussis has the nickname, the 100-day cough. So let's switch gears and talk about the vaccines for these diseases. As I mentioned, the disease-causing agent of each of these are the toxins that they produce. So to make the vaccines, the toxins are treated chemically so that they're no longer able to cause disease. These treated toxins are called toxoids, and that's why you sometimes hear these vaccines referred to as toxoid vaccines. Now for diphtheria and tetanus, there's 1 toxoid in each of those vaccines. But for pertussis, there's between 2 and 5 toxoids or proteins, depending on which brand of vaccine you get. There are currently 3 kinds of vaccines for these diseases, and the letters tell us both which diseases the vaccines protect against, as well as information about the quantities of toxoids that are in them based on whether upper or lowercase letters are used. So let's go through this. The first vaccine given to infants is called DTaP, with capital D, T, and P. That means that vaccine protects against all 3 of the diseases we're talking about today, and it has larger quantities of those toxoids. Babies get 3 doses at 2, 4, and 6 months of age, and those doses are considered to be their primary series. This means that they're not considered to be protected until they've received all 3 of those doses. They get 2 additional doses, one between 15 and 18 months of life, and then another at 4 to 6 years of age, and those 2 later doses are considered booster doses. Adolescents and adults don't get the DTaP vaccine. It's because the more doses of that vaccine people get, the more likely they are to experience a side effect where their arm that received the vaccine swells up. As a result, manufacturers made a version of this vaccine called Tdap with an uppercase T and a lowercase d and p. Now we'll talk about the A in DTaP and Tdap in a few minutes, but for the purposes of this part of the conversation, know that Tdap has the lowercase d and p because it has lesser quantities of the diphtheria and pertussis toxoids. And that means that the side effect that causes a person's arm to swell up is less frequent. There are 3 groups of people who should get Tdap vaccine. The first is adolescents between 11 and 12 years of age. The second are people during pregnancy, specifically around 27 to 36 weeks of gestation. And the reason for this dose is actually so that the pregnant mom will generate antibodies that she can pass to the baby before delivery, and that those antibodies, called maternal antibodies, can help protect the baby during that first 6 months of life while they're getting their first 3 doses of the DTaP vaccine. And then the third group of people who should get Tdap are those who would be due for their booster dose, their tetanus booster, as we typically call it. If they got a wound or if it's time for their every 10-year booster, they can get Tdap instead of Td, which is the next vaccine we'll talk about. And by getting Tdap, then they're also going to get a boost to their pertussis immune response so that they can be better protected against pertussis. The last version is the Td vaccine with an uppercase T and a lowercase d. So this vaccine also has a lesser quantity of diphtheria so that it doesn't cause that swelling of the arm that received the vaccine. This is the version that most people think of when they get their tetanus booster. But now that we have a Tdap vaccine, people can request that version so that they can also protect themselves against pertussis. So let's talk about that lowercase a in DTaP and Tdap vaccine. The A stands for acellular, and it relates to the pertussis component of each of those vaccines. We've been using acellular pertussis vaccines since 1996 in the United States. Prior to that time, we used something called the whole cell pertussis vaccine. Now, the acellular pertussis vaccine, as I mentioned earlier, contains 2 to 5 toxoids or proteins from pertussis. But the whole cell pertussis vaccine actually used whole dead bacteria, pertussis bacteria. That meant it had about 3,000 antigens. Now, an antigen is something in a vaccine that will cause your body to create an immune response. Because of all those antigens in the whole cell pertussis vaccine, there were a lot of side effects that came with that vaccine. Kids felt miserable, and parents weren't so happy either when their kids had some of the more severe side effects in particular. For example, about 1 in every 100 babies could develop uncontrollable crying for several hours. They could develop a high fever of over 105 degrees, or they could experience something called hypotonic-hyporesponsive syndrome, in which they would become limp and listless and lethargic. They wouldn't have good muscle control. In addition, about 1 in every 1,750 babies would experience a febrile seizure. A febrile seizure occurs when the body's temperature rises too quickly, and so it's actually a seizure that's caused by the fever. It's not a permanent condition, but it is scary for parents to watch. The acellular pertussis vaccine can cause all of these different side effects to occur, but they happen much less frequently. Maybe 1 in every 10,000 doses as opposed to every 1 in 100 or every 1 in 1,750 doses. So much less frequently than what we experienced. Now, one other note about this. I think we can all agree that we're happy that there's a safer pertussis vaccine in the acellular version and that the side effect rates are lower. But by using the acellular pertussis vaccine instead of the whole cell pertussis vaccine, we have given up something, and that is that the immunity after vaccination does not last as long. So hopefully someday we can have a pertussis vaccine that has a low rate of side effects, but also an increased longevity of immune response so that we can have the best of both worlds. So let's finish up with some common questions we get at the Vaccine Education Center. We're going to go through these pretty quickly, so if you want to get more details, you can check the Diphtheria, Tetanus, and Pertussis webpage at vaccine.chop.edu. First question we get is if an infant experiences that uncontrollable crying after they get the DTaP vaccine, should they get additional doses? And the answer is that you should talk with your child's healthcare provider about whether to get additional doses, because you need to really consider the risks and the benefits, particularly related to pertussis, which can be devastating for young infants. It's also important to know that most often children who experience that after their first dose of vaccine don't experience that same thing after subsequent doses. The second question that we get is whether teens and adults should get the Tdap vaccine. And there are a few reasons that you should consider getting that vaccine. First, especially if you're going to be around young infants, you don't want to spread pertussis in particular to those infants or to younger children. Second, by getting that vaccine, you can improve your own immunity against pertussis, which we talked about has this severe coughing with a lingering cough that can last for months, and against tetanus, which it doesn't matter how many people around you are protected against, your risk is still the same. And if you get a wound that you didn't expect to get and you're exposed to these bacteria in the soil, you can develop tetanus. And then if you're someone who's expecting a baby, you're recommended to get that Tdap vaccine as well so that you can help protect your baby in those first few months of life. That vaccine is recommended between 27 and 36 weeks of gestation. And although you can get it at any time during that period, it's better to get it on the earlier side of the 27 weeks because then your body has more time to generate antibodies. And if you would happen to deliver early, the baby should still have some protection from those antibodies. Another question we get is, how can I protect my newborn from pertussis? First, get vaccinated during pregnancy based on the recommended schedule. Second, vaccinate the baby based on the recommended schedule after birth. And third, protect them in the ways that we protect babies all the time anyway. Keep them away from individuals who are sick. Make sure to wash hands and toys, and do all of those things that you would do anyway to keep the baby protected. Another question we get is when people ask, do they need to get this vaccine if they've already had pertussis or if they had pertussis as a child? And the answer is yes. People can get pertussis more than once in their lifetime. And related to that, some people wonder if they had the whole cell pertussis vaccine when they were younger, do they need to get the Tdap vaccine? And that answer is yes as well. Toxoid vaccines don't provide lifelong protection. So even when you've had the whole cell pertussis vaccine, you'll still have waning immunity and you can still benefit from getting that vaccine again. Let's talk about the risks and benefits. Today we talked about these 3 diseases: diphtheria, tetanus, and pertussis. We talked about the fact that diphtheria is infrequent, especially in the United States, but that it used to have the nickname strangling angel of children because of the membrane it causes to develop in the back of the throat that leads to suffocation. We talked about the fact that tetanus is a little bit more common than diphtheria, albeit still not very common in the United States, but that it doesn't matter how many people are vaccinated, our risk is still the same because that disease is not spread from person to person, but rather from bacteria in the soil. And that there are cases of neonatal tetanus in other countries where children are born in unclean conditions and develop that disease right after birth. We also talked about the fact that every year there are tens of thousands of cases of pertussis in this country, probably more than we actually are able to determine when we do testing, because of the fact that many adults don't go and get tested early on in a coughing illness. But that pertussis can cause severe bouts of coughing in infants and adults. And those bouts can last for up to 3 months, leading to the nickname, the 100-day cough. When we talked about the vaccines, we talked about the fact that they have side effects, but for the most part, they're minor, like a sore arm, fever, maybe a lack of appetite. But that there are some more severe side effects, like a swollen arm in older children or adults, or uncontrollable crying, or febrile seizures, or other scary side effects in young infants, but that the rates of those side effects have decreased with the use of the acellular pertussis vaccine. When our team looked at the risks and benefits of these vaccines and the diseases they protect us against, we determined that the vaccines are the safer choice. And we hope that after you evaluate this information, you'll feel that way too. Thanks for listening today.